911, how can I help you?
Hi, I'm the administrative secretary at Hudson's Bay High School. I need an ambulance immediately. I've got a student overdosing in the bathroom.
Okay. All right. Are you with the patient now, or do you have info for someone with them?
I have multiple administrators, DROs, and a nurse with the student at this time.
Right.
I believe they're administrating Narcan.
On a Tuesday morning in May at Hudson's Bay High School, school officials found a student in a bathroom stall.
The student is 16 years old.
16, male or female?
Female.
Female. Is she awake?
She is unresponsive.
They locked down the school. A district resource officer wrote in a report they found burnt tinfoil and blue pills, likely fentanyl, on the girl's clothes.
You said you believe that they have been able to get some Narcan?
Yes, it was rushed up to the location of the student by the nurse.
A school nurse and a medical responder both used Narcan, an opioid reversal medication, to try and save the girl's life. She was rushed to Peace Health Southwest Medical Center, then transferred to Randall Children's Hospital in Portland, where she died 6 days later. I learned about this girl's death this past summer. Through months of public records requests, I was able to confirm she died of a fentanyl overdose that happened here in this high school. Once I knew that, I wrote a letter to the girl's parents. They're heartbroken. I was able to meet with her mom, who asked we not use her daughter's name in this story, and she didn't want to be interviewed. But she said, we should share what happened. She wants people to know, and she wants to help prevent the death of somebody else's child. On the day the student was found in the bathroom stall, Hudson's Bay High School principal Val Seeley sent an email to families. It said a student experienced a medical emergency at school and was taken to the hospital. She sent the same email to school staff members, but it was prefaced with a bolded message to read this statement verbatim to address rumors. Quote, "Don't go off script and start answering questions." A week later, Seeley told families, students, and staff that the girl died after her medical emergency. She offered grief counseling and support. The school and school district never publicly said she died of fentanyl poisoning or that they found fentanyl at school. Vancouver Public Schools Superintendent Dr. Jeff Snell says they're not required to share this information.
When there's a fentanyl overdose at school, wouldn't parents want to know?
Well, I don't know what parents would want exactly. I know in situations that, I think what you're getting at is if there's an overdose, do we just say a student overdosed from fentanyl at the school? I think that we as a school have a responsibility to be thoughtful about that and engage the family of the person that did that in terms of what's disclosed.
You would then leave it up to the families to decide whether you'd share, hey, there was a student who overdosed on fentanyl at school.
And trying to balance, like you're saying, the desire of an entire community to understand what's happening versus the desire of a family that's went through something, horrible.
But for other dangers, like a student bringing a gun to school, that information is often shared with families without the student's name. Why wouldn't it be the same with something as deadly as fentanyl?
If we want to put our head in the sand, we're just going to keep seeing more overdoses and more losses at every age level. So we have to talk about it.
Marsha Malsom's nephew, Race Rudine, died of a fentanyl overdose in Seattle in 2016. She now leads a foundation that works on fentanyl awareness throughout Washington state, talking with schools, working with the DEA, and with lawmakers.
We have a problem in our country. And it shouldn't be an embarrassment because it's in your school, but how are we going to fight it in our school? And how are we going to avoid a horrific story instead of reacting?
The Vancouver student's mom told me she would have been okay with the school district sharing that a student died of fentanyl, even if people could draw conclusions between the death of her daughter and the announcement, because the community should know about the danger. Federal agents with the DEA who investigate fentanyl cases agree. They see how these pills are in every community and say it can be dangerous to think, it's not in my school.
From the DEA's perspective, why should families and the public know about a case like this?
The transparency and the communication, it is the most important thing because we need to save lives. And the way to do that is to get the word out of how dangerous this is.
About a month after her daughter died, the Hudson's Bay High School student's mom called Vancouver police, asking them to investigate how her daughter got fentanyl. She explained that her daughter had been a straight-A student. She was on the volleyball team, but she got caught up with the wrong people. She told police that doctors said her daughter died of a fentanyl overdose. And she gave this to police, screenshots from Venmo, with her daughter paying a man and captioning the payment with a blue circle emoji with the letter M, paid about 2 weeks before her death. Fentanyl pills, commonly called blues on the street, often come with M's marked on them to look like oxycodone tablets. The police reports show that a Vancouver police detective talked with the girl's friends and family over the following months, but he couldn't make an arrest for one big reason. Police didn't have the blue pills as evidence. Police were never called to the emergency in the high school bathroom and didn't start an investigation until a month later, when the girl's mother called them. Officers were never able to develop probable cause to arrest anyone involved with supplying the fentanyl that ended up killing the student.
In that case, police were not called to investigate or file any sort of criminal report. Do you know why?
I don't know specifics about the case. I think you would have to, ask other people or look at the situation.
In any case, the delay in calling police made holding anyone accountable for the drugs difficult. What leads to a successful prosecution in a fentanyl case? What are you looking for?
With any investigation, sort of time is always of the essence. So the sooner that investigation can start, the better it's usually going to be, for a positive outcome.
Since May, Vancouver Public Schools has overhauled how the district prepares for a fentanyl overdose. District resource officers, along with nurses, now carry or have access to naloxone, an opioid reversal medication. A common brand is Narcan. It's now available at all schools, not just high schools. And nurses have a new system of logging and tracking when Narcan is used, when it needs to be replaced, and where it's available.
It seems to be a growing concern, right? And so if there's growing concerns, we want to make sure that we're expanding the services that we have to potentially address those.
Nationally, teenage overdose deaths from fentanyl more than tripled between 2019 and 2021, far outpacing every other type of drug. Washington is one of several states that requires many schools to have opioid reversal medication on hand.
Part of our foundation's work is we do naloxone training or Narcan training. And I've had from parents to administrative staff say, we don't have drugs in our school. And that's not facing reality. It's there. It's in every school, unfortunately. It's what each school does to handle that will make the difference.
But that state requirement is limited. Only school districts with more than 2,000 students are required to stock naloxone. It's only required for high schools. There's no set funding for schools to get the medication, so they often rely on donations. And crucially, Washington State Education Agency doesn't track when school officials use naloxone, so there's no way of knowing how many kids may be overdosing or how prevalent fentanyl is.
We know metrics really help us have better education, better research on how to be more proactive, how to educate the community better, and it's a shame we aren't tracking it in a very confidential way, just to the numbers.
That means school districts are often navigating on their own, deciding how or even if they should share when they find fentanyl in school. Snell says his district is trying to be proactive, sending out messages to families about the threat of fentanyl and what to look out for.
You talk about the education and informing about the dangers being very crucial. Wouldn't the most poignant time be that when something has happened to come out directly and say, hey, this happened here?
Certainly in some situations it could be. Yeah.
Malsum says that's not enough. People should always know, and families should be talking about this.
The highest danger is it will happen again. If people don't know this is happening, how's it going to stop?
Evan Watson, KGW News.